Hey there, health professionals! Today I'm diving into a topic that's got the global health community on high alert, the resurgence of Mpox, formerly known as monkeypox. The Africa Centers for Disease Control and Prevention, or Africa CDC, is set to declare Mpox a public health emergency of continental concern next week. This is a significant move, marking the first ever such declaration in the agency's history. Why now, you ask? Since January 2022, over 38,000 Mpox cases and 1,456 deaths have been reported in Africa. This year alone, 10 African Union states have recorded more than 14,000 cases and 450 deaths. That's a 160% increase compared to the same period last year. Recent outbreaks in Ivory Coast, Kenya, and Uganda are particularly worrying, as these countries have never recorded Mpox cases before. The surge is largely driven by a new variant of the virus known as Clade 1b, which originated in the Eastern Democratic Republic of Congo. The DRC, the epicenter of this outbreak, accounts for over 96% of both cases and deaths. Jean Kaseya, the director of Africa CDC, emphasized the significance of this declaration in mobilizing resources and controlling the outbreak. It's expected to boost the production of diagnostic tools within Africa and ease import restrictions on medical supplies. At the same time, the World Health Organization is considering a similar global declaration. WHO Director General Tedros Adhanom Ghebreyesus announced that an emergency committee would be convened to advise on whether this outbreak represents a public health emergency of international concern. So what does this mean for health professionals around the world? The US CDC has urged doctors to be vigilant for symptoms in travelers from affected countries, even though the risk in the United States remains low. But remember, vigilance is key. In Africa, the situation is dire. Mpox is spreading in ways not typically seen in the West, including within households and healthcare settings where personal protective equipment is limited. The virus is also making its way through displacement camps in conflict-ridden areas. The new Clade 1b variant is particularly concerning because it's spreading sexually, posing a higher risk of rapid transmission. In areas with significant population movement, this could lead to a swift and wide-reaching spread. While the global wave of Mpox has largely receded, the virus isn't gone. The US continues to record several cases a week, and the recent surge in the DRC has raised concerns about potential international spread. Let's face it, African countries bearing the brunt of this outbreak lack the ample supplies of vaccines and antivirals that helped end the international health emergency last year. Vaccine distribution in these regions presents a logistical nightmare, with some communities only accessible by boat. However, efforts to expand vaccination are gaining steam. WHO Director General Tedros has taken steps to accelerate vaccine access in lower-income countries and allow international aid organizations to distribute shots. So, health professionals, stay alert and informed. The world is watching, and your role is crucial in managing this ongoing crisis. Thanks for tuning in, and stay safe.